Welcome to Fun Facts Fun World. Today, let us explore one of the most ancient diseases in human history, tuberculosis. Tuberculosis, or more commonly referred to as TB, is a devastating lung infection that will kill you but will take a long time to kill you. This disease has been with humans for as long as 3,300 years. And today, we still can't really deal with it properly. What is it that makes tuberculosis so annoying and so deadly? Join me as we find out. First of all, what caused tuberculosis? Tuberculosis is caused by the bacterium Mycobacterium tuberculosis. Well, kind of gets a name from the name of the bacteria. The reason why tuberculosis is so hard to deal with is kind of complicated. And the main reason goes down to the fact that your immune system cannot kill the bacteria normally. This is a result of a kind of resistance mechanism that the bacteria has developed to the immune system's attacks. This means that the immune system deploys very interesting tactics to try to finish the bacteria. Well, by interesting tactics, I mean forming those very iconic cottage cheese-shaped regions and lesions on the surface of the lungs. Those are called a Gone complex and are your immune system's attempts to wall off a region affected with tuberculosis and starve the bacteria. Does starving enemies out sound like a good plan to you? Well, it kind of is a good plan. But the way your immune system executes it isn't that perfect. When your immune system tries to starve out the tuberculosis bacteria, it ends up accidentally starving out all the healthy tissue in the region as well. This can lead to holes forming in the surface of the lungs. Tuberculosis bacteria can also survive this kind of starving by entering into a dormant stage and just, not use as much energy as before. You can say this is one bacteria that kind of acts like bears. Hibernating bacteria, hey? Tuberculosis is also very hard to treat. Treatment of tuberculosis usually lasts about 9 months to over a year. First off, patients are usually prescribed 4 to 6 different kinds of antibiotics to take every single day for 4 months. Very soon after that, about on the 6th month, they can switch taking 2 antibiotics alone, and those 2 antibiotics are usually rifampicin and isoniazid, which are also the 2 most common medicines used to treat tuberculosis. A lot of patients don't even finish their full dose of medications because they feel that they're fine after taking medications for a few months. But keep in mind that you need to finish the course of your medications because if you don't, it can lead to your doctor getting mad. Just kidding. It leads to antibiotic resistance. Antibiotic resistance means that the bacteria is no longer susceptible to the drugs that are prescribed to fight it. This is an increasingly dangerous problem in basically every country around the world, as more and more cases of drug-resistant tuberculosis has been claiming lives around the world. There is, however, a lot of promising technology that may help us defeat tuberculosis in the future. For example, the vaccine that has already been created and is in usage, the BCG tuberculosis vaccine, well, if it just improves a little bit, just a little bit, right? It could be the number one tool for us to eradicate tuberculosis from the surface of the planet. Scientists are also researching new medications to help fight tuberculosis. New antibiotics are already on the way of development to combat the drug-resistant issue that tuberculosis have given us. Alternative ways of fighting this bacteria has also been looked into, such as immunotherapy and bacteriophage therapy. All these technologies in the future can help guarantee us a tuberculosis-free world. And I, for one, knows exactly how to celebrate. I'm
gone with T beat. Last but not least, flash news. Recent technological developments had made a special quick treatment plan involving a couple of different drugs that can cut the treatment time of tuberculosis in half. Cheers for everybody. Cheers for science. Psst, did you know that the subscriber monster is also only one click away? Quick, tap on it. Finish him. I know you can do it. But seriously though, if you enjoyed this video, consider subscribing and leaving a like down below. It would really make my day and show your support for my channel. Anyway, good day. Thank you for watching. Bye-bye. Catch you in the next one.